up. There we go. Okay, wonderful. So as Daniel kindly said, I'm Dr. Chantal Roddy. My role within the DREAM project is the Community of Practice Coordinator. So I'm going to dig in a little bit today to explain, if you don't know already, what a community of practice is and how a community of practice is sitting in context at the moment for our project. To rewind the scope a little bit, DREAM, when we talk about the DREAM project, I know it's a funny acronym, we are talking about the Dementia, Respite, Education and Mentoring project. Now, this project very much came off the back of the EQUIP project. Have people heard about the EQUIP suite of training for aged care? No? No? Okay. So essentially, over the last couple of years, the University of Tasmania and the Wiking Centre, where I'm from in particular, have developed a suite of free online training for aged care, which is designed to step people through all sorts of foundational aged care knowledge. Some of that knowledge is about the aged care system itself. Some of it is about like compliance and quality and infection control and prevention, all sorts of different elements of aged care. And it's really designed for the workforce to help provide a basic skills overview for aged care. So having done that work and built up those relationships in the last couple of years, it became pretty apparent to the team at Wiking and the university more broadly that there was a bit of a gap in terms of some of the skills for the aged care workforce. And what really came up was a central gap around understanding how to provide the best possible dementia respite experience for clients. We know that statistically, and I haven't brought all these stats in today, I didn't want to be too formal. We know that statistically, a lot of our aged care workforce may not necessarily be highly experienced yet. They might be fairly new in the profession. A lot of our workforce are also probably from non-English speaking backgrounds and are quite culturally diverse. They do get, of course, opportunities for training in their workplace, or if they've done a formal training course, which they don't necessarily have to do. But if they have, they will have a basic level of training through there. But we know that all of those pathways don't necessarily provide them with a very high quality education about dementia. And what we're finding, therefore, is that people's confidence in knowing how to work with people with dementia well can be limited. And so we really recognise that training gap in the workforce and sought to focus on dementia respite in particular. Now, those of you who might be research minded, if you've ever tried to have a look for any research on training in dementia respite in particular, it really doesn't exist. Yeah, have people noticed that in your travels if you've ever looked into that area?
Sorry, Chantal, can I ask a question? When you say respite, are you talking residential respite or are you talking community in-home?
All forms of respite.
All forms, okay,
yep.
Great.
Yeah, respite in the bigger sense. Yeah, good question. Yeah, so there really is a scarcity of dedicated training for dementia respite. Now, we know in a way that issues that come up in dementia respite are not always unique to respite. Sometimes they can be, but we know that providing a quality education for the workforce around dementia is hopefully going to improve the experience of people using respite. Hopefully, it will increase the chance of respite being successful so that people are more likely to use respite in the future, so that carers can get the kind of breaks that they need to meaningfully, and so that people are supported if they do choose to transition into permanent care, for instance, that can also be facilitated. As well as obviously keeping people more independent at home as well. So that was sort of the niche where our project really sat. And our project has developed into 3 different components. We have been very fortunate to partner with Dementia Support Australia, who are delivering a coaching arm to our project. So internally, as the core team in Wiking, we've developed 5 different education modules that are specific to dementia respite, and I'll show you what they look like in a moment. We've also got a community of practice, which is the sort of platform that I run, and I can talk to you about that in a minute too. And then we have coaching. So our coaches, we have 7 coaches currently across Australia, and their job is to help reach out to workplaces and to really train the workforce on any issues that come up in the course of dementia respite. So they sit very much in harmony with the one-on-one sort of case support and, DB Mass and all those services that are one-on-one caseworkers. They're not necessarily doing that work. They're training the workforce. So they will work with groups. It can be as few as, a couple of people, a couple of workers or staff. It may be as many as 150 that they've trained. And so they're very flexible to work with any key issues that come up in the course of dementia respite, and particularly around the key themes of DREAM, which I'll show you in a moment. So if you do know any service providers who are looking for any sort of coaching support, feel free to reach out to me and I can explain a little bit more about that, or you can have a look at our website as well. Because our DREAM project was part of a very large $8 million national grant, all of the services that we're offering through the education, the community of practice and the coaching are of course free of charge, so there's no cost associated to workplaces for those services. Okay, so these are our 3 DREAM pillars, if you like. We have the education modules, which I will show you the themes in a moment, in a couple of slides' time. We also have some learning resources. We have a wonderful educational designer on team who has expertise in designing dementia-friendly graphics and making sure that all of the learning materials are pitched appropriately to a variety of audiences. So we have some tailored infographics. We've also linked out to a sort of whittled down version of the Equip Aged Care Learning Package with topics that are relevant to dementia respite in there as well. And we have a smaller version of our Understanding Dementia MOOC. So there's quite a comprehensive sort of training package available to people to complete online. Has anyone, out of interest, has anyone heard of any of this training or done it or recommended it to their workforce at all? It's totally okay if you haven't. I'm not here to do a big plug, but I was just curious as to whether anyone's come across it yet.
No, not yet. Not for me.
Yeah, no problems. I think at the moment, because it's a little bit more niche, we're working to sort of get the word out there and make people aware that it exists. But if we get time at the end, I can certainly show you a walkthrough of the actual live training and the community of practice so you can see what it looks like. Our coaching obviously has national coverage. It can be online, it can be virtual. And the dementia support coaches are really geared up to work with any key sort of areas of training that the workforce needs. That can be identifying any kind of key strengths of the workforce, addressing any challenges, really looking at that skill building and making sure that staff are as equipped as possible to deliver a quality dementia respite experience. You've probably noticed in me talking by now that I'm not necessarily talking with a very direct consumer lens. So I'm not necessarily pitching this in a directly supporting people living with dementia sense or directly supporting carers sense. And that's purely because for this project at the moment, our core funding from the government is for the aged care workforce. And so we've had to narrow down the focus a little bit for most areas of our DREAM project to target the workforce. We'd also love to be doing parallel work with people living with dementia and with carers, but that's not necessarily in our suite of offerings right now. The place that we can accommodate a consumer voice and a carer voice is the community of practice. Has anyone had, I know Dementia Australia people you have, because I've been part of that recently myself as well. Has anyone else had experience with a community of practice? Is it a familiar term at all? No? Is anyone brave enough to tell me what they think a community of practice is?
Yeah, so they probably mean different things potentially, but yeah, usually it's around, a group of practitioners, similar, with a similar cohort and looking at best practice, reviewing best practice and sharing.
Absolutely, yeah.
As best I can understand it.
Yeah, absolutely. Yeah, so a lot of the foundational work for communities of practice really came from the work of Etienne Wenger and colleagues, like way back when, quite a few decades ago, looking at social learning, so how to facilitate people coming together with a shared interest to learn about best practice and improve their practice in a particular domain. And so for us, our community of practice is really, again, primarily targeted towards the workforce. We really want industry engagement to drive the community of practice. It's designed to be a really safe space online where any of the aged care workforce can really come in, ask questions they might have, link up with people who've had a lot of expertise in dementia respite. We've got, clinical managers and wonderful clinical educators and all sorts of people in our community. And so tapping into some of that expertise to feel safe enough to ask questions, to look at just engaging and sort of sharing their experiences with each other as well. What worked well, what didn't work so well, what are some of the shared challenges? We've also hopefully are bringing up a safe space for people at the moment to reflect on some of the systemic challenges of working in the aged care workforce. We know it's not an easy time, particularly at the moment, and hasn't been for quite some time. And so giving people a space where they feel safe to open up about some challenges and to receive some help, or even just to link out to other people for support as well. So we've done a virtual community of practice. I know some other areas that have developed a similar community of practice will link out and perhaps do a meeting once a month or something like that. We've chosen at the moment to do it asynchronously. So we've built a website with lots of features, which I'll walk you through in a moment. And the website essentially houses a really big resource library with lots and lots of different resources around dementia, respite, all sorts of other topics of interest. We've also got the capacity to publish video blogs, like text blogs. We're working on a podcast, which I'll talk to you about. And then we've also got the ability to ask discussions, to reach out for help, frequently asked questions, etc. So it's essentially a little web community and a safe space for people to come together. With the community of practice, although we have primarily targeted it to the workforce as the primary invitation, we're certainly welcome. I think it's a very powerful part of a community to have a direct consumer voice, of course, and to have a voice from people who've used respite, from families, from carers. So we're certainly not excluding any of those voices in our community of practice. I think you'd agree that in any sort of service provision role, hearing from the people who are the ultimate goal of the service and who use the service is probably the most important thing that we can do. So there's absolutely a voice for that in our community of practice as well. Are there any questions so far on any of those overall elements or anything else you wanted to know at this point? No? Okay. Do reach out if you have any questions. All right. To give you, I won't spend too long on the next couple of slides, but just to give you a little bit of a sense of sort of how this came to be, we didn't just decide amongst ourselves that there's a bit of a gap here. We actually had a very careful look at it and derived our 5 key dream themes from a pretty exhaustive process. So essentially, being academics that we are, our team completed some literature reviews, having a look at and in particular, our academic lead, Dr. Razan Bazuband, was able to do a literature review looking at which training programs are out there. So we looked pretty exhaustively at the literature to identify any current dementia training opportunities that are open to the aged care workforce. After reviewing the content and the scope of those training opportunities, there was a process of consulting stakeholders. So we actually reached out to a range of respite providers across Australia and completed a bit of a needs analysis by looking at essentially the areas that are covered, the areas that haven't been covered yet, and mapping those against areas of need. And what we were really looking to identify through that process was workforce gaps. So from the minds of providers, what don't the workforce know yet that could be helpful in improving the quality and the consistency of dementia respite care? There was a survey also completed by a range of staying at home providers and carers as well. From those, there was a thematic analysis done to pull out those key gap areas, to look at the areas that were emerging as needs. And then in turn, that was whittled down into 5 key topic areas. So I don't need you to understand all the ins and outs of that process, but just know there was a fairly rigorous process undertaken to make sure that A, we're capturing the right gaps, and B, that we're not duplicating existing services or training. So these were the key themes that we landed upon. One is essentially foundational knowledge about dementia. So unpacking, we've called that unpacking dementia and respite care. We know that a lot of the workforce don't necessarily know a lot about the the fundamentals of dementia, even the fact that there are different types of dementia, how that presents, and the fact that one person with dementia is not the same as the next person with dementia, etc. So a lot of those really key things, and obviously being the Wiking Centre, we're pretty well positioned to put together some expert content around what dementia does in the brain and some of the basics. Also, another key area that emerged was knowing the person and respite care. So really essential in respite to know the individual, and particularly so in respite, right? Because there's such limited time to work with someone quite often. So if you don't know all the key ingredients about that person, oftentimes you're spending a lot of time catching up, or you're not necessarily able to maximize that respite stay to be the best possible stay that it can be. Also, navigating behaviours in respite care. And I know that this one is a very key theme that will come across probably all aged care sectors, but particularly in respite, again, when there can be changed behaviours coming up that are sometimes difficult to support, difficult to understand for the workforce. It's very important to have some targeted information around how best to support those changes in respite. I myself am a neuropsychologist by background, and I've also worked for many years as a behaviour support practitioner. So I was able to have input into that particular script, given my background. And a lot of us have kind of cross-clinical experience we can draw from in pulling together some of this content in collaboration with the workforce. Relationships and communication. Probably this could encompass all other areas, but this is such a key one as well. Supporting not just the relationships with the person living with dementia in respite, but also communicating with family, knowing when and how to communicate with family, communicating with people from all sorts of diverse backgrounds, and understanding, socio-cultural context is equally important. Also, how to plan for success. So we know that a lot of respite stays, for lots of reasons, there may not necessarily be the best quality information that's able to be planned in advance of someone's stay. And sometimes that lack of coordinated information and planning to begin with can lead to some key gaps that perhaps, can sometimes threaten the quality of that stay, or maybe make someone a bit less likely to use respite in the future. So this is really around understanding what key information needs to come together to support planning a successful respite stay. Okay. And then we've also done a bit of a catch-all. It's not a formal topic area in the Dream Education, but a catch-all for general, anything that's broad and broadly applicable to respite, or any other sort of topic areas generally. So you can see we've still got quite a broad coverage of areas there. Are there any thoughts on those themes? I could see a few nods. Are they resonating with anything that you've seen in terms of gaps?
Absolutely. Having worked in sort of the acute part of aged mental health for many years, and going into nursing homes, and we had, I can talk about an experience that we've had recently where we've got a client of ours in a nursing home, was in respite and now become permanent. And they basically were saying, we can't manage her, you got to, she needs to come into hospital. They've tried to send her to ED and all of that. We went out yesterday, and to my horror, I realised that they don't know anything about this woman. They do not know what she did for work, what her likes or dislikes are, what could be potential triggers. Like, she's been going around looking for dead babies, and they didn't know that she's actually lost a couple of babies. And I was horrified, and I said, it is your duty of care at the point where someone gets admitted, whether for respite or for permanent care, that you actually understand who the person is. Before they had dementia, they were, they've been mothers, they've been wives, they've been sisters, they've had an active, productive life. And I said, and if you don't know anything about them, how are you going to be able to best meet their needs? And they label them, obviously, they've got BPSD. And I'm not saying that there isn't a BPSD, but bombing them out with medication to the point where they're zombies and falling over is not what we're on about. We have to look at these strategies. And I was actually appalled. And in relation to that, and I've had a mother with dementia, and I've had home care packages and all of that, and I've really identified there's such a lack of education amongst support workers that often, they do a couple of months course, they get allocated to clients. They don't realise often that dementia is not just about benign memory loss, but the functional decline that also is associated with it, where you have to think, for a client. And so I'm actually in the process of doing some training with home care providers just to upskill people in working with older clients with mental health issues, and obviously dementia is a very big part of that. But I agree, yes, knowing the person is paramount to being able to actually provide a good experience and really meet their care needs. So
absolutely, absolutely. Thanks, Maria. That's really helpful sharing, and I completely agree.
Yeah.
If those of you who are passionate about dementia, and I'm sure you all are, that's why you're here. But in dementia, we talk a lot about the key idea of personhood, right? Not losing sight of the person amongst the diagnosis. And if we know those key things about someone, even the tiniest bit of information can really help us unlock a whole background to that person, to help bring them out in a person-centered way, to, if we need to use a trauma-informed approach, and to adjust how we do things in the best interest of that client. So yeah, it's so important to be aware. Yeah, I've certainly had some similar experiences. And we know respite in particular, we sometimes get asked the question, why respite? Because it is quite a niche, I know that it's can cross a whole lot of different settings, but in itself, it's quite a specific area. And I think the why respite for us is because respite can be quite a challenging experience. Not always, of course, it can be wonderful too, but it can be a challenging experience because there's lots of transitions. And for people with dementia, that can be very difficult to adjust to, as we know. And that could be having people who are not familiar coming into your home and looking after you. That can be quite unsettling. It can be going somewhere that you're not used to, being away from home, being in residential respite, or even going to a day centre, going to a college. There's lots of transitions there that can be really difficult. And we know that to make respite successful and to make it work as well as we would like it to, we also need to have the ability to support respite to succeed for the duration that it's meant to, so that carers can get the break they need to, they can be refreshed, they can continue their caring duties, etc. So there's quite a lot at stake when we think about respite. Yes, there's a question there from
I was just going to say that if respite goes wrong, the impact is huge, because you have so many carers that then won't put that person back in that facility or try respite again. And so then you've got people that are still at home and the stress levels just increase.
Yeah.
And it's just, it's vital to get, respite right. It just is. And in the community, the number of carers that I've had where they come and they just say, the support worker just comes and just sits there, and they don't, they don't talk, they don't do anything, they just sit, and it's like, well, ask them to go for a walk or do something. But it's, it's then another thing that you're putting on the carer to then tell the support worker what to do, which
absolutely
is the complete opposite of what respite's supposed to be about. So
absolutely,
it's vital to get it right. Yeah.
And even going just further back a step, how do we introduce it?
Yeah.
How do we get the person with dementia to agree?
Yep.
How do we get them
consent
there?
is definitely challenging. Yeah, absolutely. Yeah, absolutely. And then supporting some of the confusion and the disorientation that can come if they arrive at respite, and even if they're aware and they've consented and they get there with the best intentions, it doesn't always, go as smoothly as we like it. We know that. That's the nature of the territory. So knowing then some essential skills to know how to support that, to get through that, is really key for workers as well.
Absolutely.
Yeah. Okay. To do a little sideways step again into coaching, I've talked about this already a little bit, but to give you an idea, so far we've been at it for about 6 months. So we launched, formally launched at the end of July, but sort of had content up and running from July last year. And in this time, our Wonderful Dream DSA coaches have delivered coaching to over 1,200 participants, and they're from a variety of respite providers around Australia. They've done about a little bit more virtual coaching than in-person coaching, but 63 in-person and 68 virtual coaching sessions. So obviously some of those are including a number of workers in each group, and they do have availability for referrals. So as in my finishing slides today, I will have all the details for the Dream site, so you can have a look. If you do know any providers who would be interested in referring for coaching, please take up that opportunity. There's certainly nothing lost. If you're not sure if it's a suitable referral, they're always welcome to spend the time to triage it with you and have a chat and talk about needs for providers. So please reach out if you would like to use that service. In terms of the community of practice, this is my baby, but I promise I won't harp on about it too much. I just wanted to give you an idea. So community of practice, as we've talked about, it's really a place for people to get together with common interest area and to share their experiences, and with a view in the bigger picture for us of upskilling the workforce to provide the best possible dementia respite experience. Hopefully also, if we can get some traction through this project, it's relatively early days for us now, but if we can really get some meaningful workforce engagement and we get people together who are very passionate and keep building that community, I'm hoping that we could even look at, developing some best practice guides around dementia respite and actually being a bit of a, being a bit more of a visible presence out there to keep improving, continuous improvement for the workforce. So essentially, we shaped the features of the community of practice by looking at what's worked in the past. So I certainly did a pretty exhaustive sweep of literature from communities of practice. There are quite a few communities of practice in different domains that are not necessarily healthcare. And then the last sort of 10, 15 years, we've seen more communities of practice come into the healthcare space. And then probably the last 5 years, we've started to have a few more communities of practice look at dementia in particular and building networks, meaningful networks around dementia. So it's a relatively new space. We don't have a wealth of research to understand this very well. And communities of practice can be fickle things that sometimes are sort of challenging to build and grow. But what we do know is that the communities of practice that have been out there have definitely been necessary and have contributed to some meaningful engagement for people and are able to add value. What we found, from the searching of the literature is that the community really needed to be interactive. So it needed to be not just a, static sort of web page where people look at resources. It needed to be as interactive as possible to let people have a say and to be heard and to have people responding to that. Also needs to be accessible and user-friendly. So we know, again, that workforce may not necessarily even have access to computers, particularly to look at things on. So they may be looking at their phone, when they're on public transport. They may be looking, briefly at different times of the day. So we needed to remove as many sort of technological barriers as we could. We wanted to produce, yes, expert content, but not with a view to making it really high level and challenging to digest, because that's losing the point. We wanted to make sure that the content is approachable and accessible for the audience that we have. So we do have content that's targeted at a range of reading levels, but we've tried to make 99% of things on the community of practice readable at a grade 8 level. So to make sure that it's accessible for people as far as possible. Also tried to provide some flexible communication methods. And we tried to look at really developing some goals for the community over time, which reflect the user needs. One of the biggest risks, if you've ever had involvement in a community of practice, you know that the challenge is that the people who start the community of practice shouldn't dictate where the community of practice goes. Okay, our danger as Wiking, yes, we know dementia, and yes, we know, we know some expert content in that space, but none of us are experts in dementia respite. Nor do we pretend to be, okay? So what we really need through this community is to keep building links with the workforce, because this is for the workforce. And we want that to really be co-delivered with the workforce as much as possible so that it can meet their needs. And I'm not going to sit here when I'm developing this community and assume that I know what the workforce needs. We've got a variety of ways of actually asking them, which I'll talk about in a minute. But also we want, by building that active engagement with the workforce, it's so that they can tell us what they need and we can respond accordingly. So we don't want it to be a didactic, we're going to push this content at you, because that's pretty meaningless. Okay. All right. So in terms of the features, again, this is not designed to be perfect. There's certainly lots of room for flexibility and scope and development. But to start with, you can see lovely Sarah's face up there. She was one of our member spotlights when we launched. We have blogs. So again, they're not lengthy. They're sometimes sort of 400 or 500 words, sometimes 200 words, usually with some pictures, sometimes linking out to videos or other resources. They're designed to be a real snapshot of a particular content area. At the moment, they've been mainly text-based, brief text-based with some additional supporting materials, but we're looking at actually developing video-based blogs as well, which are, again, a bit more interactive and engaging, and also looking at a podcast, which I'll talk to you in a second about. Discussions as well. So having an ability for people to ask questions, to discuss things with each other, to share experiences, to have that sort of back and forth where people can get to know each other and discuss key things. We've also got a member spotlight feature, of which Sarah was a wonderful one of our, well, in fact, our very first person at launch. And this is designed just to showcase people from the community. It can be people with extensive experience like Sarah, or it could be really anyone in Respite who wants to share their experiences and to be featured. So that member spotlight is really a rotating thing just to provide a bit of visibility for some of our community. We also have the practice spotlight feature. So we're currently building some links with, I'm not sure if you know what I mean when I say Stream 2 providers, but essentially the government has a range of innovative models of respite providers who are given project grants to deliver very particular models of respite or to try new initiatives in respite. And so the practice spotlight feature is designed to showcase some of those providers and what they're doing so that people can see some interesting ideas around things maybe they haven't tried in respite before, to learn something new, to understand about different settings of respite. We're also looking to showcase different roles in respite. So I really wanted this not to be a top-down, you know, all very experienced expert people, because that I think feels a bit distant and inaccessible to the workforce. I wanted to feature a snapshot of like what a PCW does versus an AN versus, you know, someone who's working in leisure and lifestyle versus an allied health professional. So we're really looking to build links with people who are happy to share some of their stories and experiences and make those different roles more understood, so that people come into Respite with a bit more of an experience of who they're working with. So I don't know how you found it as a community, but I know in my time in when I've worked in aged care and supporting NDIS clients and things in Respite, I know that you often come in and it's not necessarily always clear who to talk to for what. And even within the teams, people may not necessarily know what, you know, particular allied health do if they don't intersect with them very much. So I think building that idea of a sort of collective community in Respite and understanding what everybody does is nice to have as well. Yeah. Then we also have a really big resource library. I'm just going to show you a little bit. This is not the greatest example because it looks really flat on this particular slide, but the blogs, for instance, are just like very short little text-based snapshots, as I've said. The discussions, again, we have the ability to raise a particular prompt or query and have a discussion flow on from that. And then our resource library, it's a little bit hard to see here, but I can show you the real thing in a minute. Resource library is really able to showcase a number of different types of resources, from infographics that we've developed through to reports, you know, policy, videos, webinars, websites, etc. So that's a whole sort of curated collection for the community of practice in particular. And then we have our member spotlight that I've talked about. And that does open up to a little bit more of a profile if you click on that on a live site. And then the practice spotlight. So these features are not designed to be 100% prescriptive. It's just where we started from, knowing what's worked in the past and hopefully developing an engaging sort of suite for our users. Is there any feedback on any of those features or anything you'd like to add before I move on to sort of where to from here and a few key points? No? Has anyone had experience? I'm guessing my DA colleagues will have, but has anyone else had experience with communities of practice before? No? Yeah, I think one of the slightly, I won't call it an existential challenge, but one of the challenging things at the moment about the community of practice is really how to sell the benefits to the workforce, because I completely understand people are very time poor, and this is one more thing when they've already got training and compliance and then all of the suite of aged care changes and everything else coming up upon them this year, which is challenging enough as it is. So we appreciate we're trying to sort of market this into a system that's already very overwhelmed. Because of that, we're looking at the moment to actually move away a little bit from the name community of practice, because it's a bit of an academic term, and I imagine to someone who doesn't speak English as a first language and hasn't really heard of DREAM, that name is going to be meaningless. So we're looking to sort of rebrand a little bit, but I'll keep you posted on any changes in that space soon. I think, you know, we are asking a lot of people to engage in something above and beyond what they're already doing with work. And I think hopefully if this community can keep gaining some traction and getting some meaningful input, then people can see what it can give them. And I hope that people can find a safe space to raise issues, to connect with other people, to access resources. So to try and keep it as relevant and topical as possible, we thought that maybe a podcast might be a nice way to also allow people to reach resources and listen to things outside of having to formally sort of go onto the website and read things, which can be more time consuming. Obviously with a podcast, you've got the flexibility of accessing it anytime, anywhere, and having little short sort of bites of information as well. We also quite like the idea of just keeping it a little bit more informal. We're not looking to educate all the time. We actually want the chance to have 10-minute chats with somebody about their role, or to talk to someone who's been in respite for 20 years, who's got, 4 or 5 key things they want to share that are really salient. So those kind of things, just having those high level chats and keeping it quite informal is what we're developing with the podcast to sit alongside the existing resources. And then we've also been collectively, as much as we can, trying to wrap our brains around a lot of the aged care changes that are coming up this year. And I know that a lot of you will be in this space as well with me, and you'll probably feel some of the shared challenges about that. We know that likely a lot of the aged care workforce is very anxious and trying to get their heads around all of these regulatory changes and model changes and rolling outs of all of the strengthened standards, etc. And so hopefully if we can provide a space to reinforce some of that content, that will be helpful for people as well. There are a number of areas like, person-centred care, trauma-informed approaches, end-of-life care, and key topics that are coming out quite a lot in the new strengthened standards that we are already tapping into through our community and will continue to. But we're looking at just being responsive to help people prepare for some of those changes as well. In terms of, just to give you a very quick idea, who's using Dream. So we've had about just over 3,500 enrolments from the workforce to date across Australia. And if you look at the mix of roles there, it's quite diverse. So the largest group is personal care workers, which is probably not unexpected, and that's great to see them on there. I don't quite know what that taps into, but I think it would be possibly a variety of other people who are perhaps not directly in respite, but involved in caring roles and similar things. And then we do have representation across all forms of respite, so residential respite, TCPs, cottage, all of the different models. So we're getting quite diverse take-up, which is lovely to see. This one's a little bit small, sorry. In terms of how we're evaluating it, there's obviously a whole range of Dream-wide evaluation that I won't talk to you about too much today, but we are looking at really obviously monitoring numbers, having a look at how people are interacting on the community. So we've got a lot of back-end Google Analytics and things that we've plugged into our site to look at what people are engaging with, what they're interested with, what they're spending time reading or listening to. Also doing some little pop-up survey polls to help see what people like and what topics are of interest and not. We've got a formal user needs assessment survey going out shortly as well to all respite providers, as well as people who already signed up to Dream, to have a look at what they would like from the community. So to try and tailor it as much as we can to their needs. And then we also will be doing some focus groups and the research evaluation side alongside in due course as well. So just to know that we're sort of evaluating a range of aspects of the project. How can you be involved? This is the part where I throw to you and see if any of this is of interest in your respective contexts. But of course, you're welcome to yourself or asking other people to complete the Dream Education modules is a really good place to start. And remember, in those Dream Education modules is the 5 new modules that are developed particular to dementia respite, but also the Equip aged care suite, which is really valuable for any aged care workers, and then also the modified sort of condensed Understanding Dementia MOOC. You're welcome to also book a Dream coach. Have a look, have a chat to them if you think that service might be of interest, and see they can triage it for you and see if it may be a suitable referral to come and work with the workforce. Of course, more than welcome to come and join the Dream community of practice. We are building and developing content as we go, so it's very much a dynamic space, but you're welcome to join. We're also actively linking out to the industry at the moment to get people actively into a community of practice working group to help really drive the development of the community of practice from industry, so that we're not, it's not a top-down approach. We're actually partnering with them to see what they need and responding to that. Of course, we will have the Community Practice podcast appearing very soon, hopefully the next month or so. And then we will have blogs and discussion boards and things like that. If you are somebody who is very connected to Respite, or you have certain expertise in dementia that you think would be really valuable for the community to know about, you can always reach out if you're happy to write a couple of paragraphs, if you're happy to have a 5-minute chat for the podcast and you'd like to contribute or know somebody who would, we would love to hear from you. So please let us know if you're happy to contribute. Obviously, for the entirety of the project, but also for the community of practice, feedback. So if you know people who are providers, link them into the survey that will be up in the next couple of weeks on the Community of Practice website to tell us what they would need and how we can best serve them through this project. And obviously, in a broader sense, if I could recruit each of you to help spread the word about the Community of Practice and the broader DREAM project, that would be amazingly helpful for us and hopefully will help us have a richer experience with reaching out to the workforce as we go. Okay, so I've got a little, those of you who have a mobile phone handy, there's a little QR code there that hopefully works, but if it doesn't, just head to dream.utas.edu.au, and that is the DREAM project. The email, similarly to reach the overall team, is the dream@utas.edu.au. And the one underneath that is my email for the Community of Practice. If there's anyone that wants to particularly target that, you're welcome to direct them to that email. But I think that's the key points that I wanted to say. Thank you so much for having me to chat to you. Are there any overall questions that anybody has or anything I haven't covered that you'd like to know about the project? Is there any feedback, anything you've not expected, anything you'd like to see tweaked or changed or developed?
Yeah, I'm probably, like I said earlier, quite new to aged care and dementia. So, like, I think the level there is a lack of educational sort of resources out there. I think having a workforce, like trying to think through how do they fit in. It's pretty hard to get workers to a staff meeting, like. And coordinate that. So practically in my head, I'm trying to think. I mean, I'm very supportive of community practices. I think they're quite effective and quite great. But like it's probably the capacity and motivation to get people there is sort of one of the challenges. But
yeah. Absolutely.
Like I said, yeah, I think there is great value. You know, you talk about personhood and the way you're thinking, and Caledonia does a lot of internal training, which I think is really essential. But I think backed up with another project is quite good.
Yeah.
So it's more comment rather than question, really.
I'll just show you a tiny bit, just because I did promise you a little bit of a walkthrough, just so you can sort of see the guts of what the community practice looks like. I can show you the other elements if we have time, but this is how it's basically broken down at the moment. So we've got our overall homepage, which has a little taster of everything on it, and then we have the blogs section, the discussions, the resources, and the help. And so you can see, if you look at the blogs here, these are some of the more recent ones that we've put up. Like if you go into it, so this particular one here is just a couple of, is that going to load for me? Yeah, a couple of key points around, supporting behaviour in respite. And we just keep them pretty brief and then invite conversation. So we'll have people comment on here and say some things that have worked for them. It's pretty digestible. It won't take more than like a couple of minutes to sort of read through and have a little bit of a grab, and it just starts some conversation. Similarly, like for this one around younger onset dementia, this one's a little bit more involved, but we always try and sort of add a bit of value with either like an infographic like this that people can download, and key points and things like that. So and then also in the resource library, the discussions are further down here as well. So we've had a bit of discussions recently around some trauma-informed case studies, some spotlighting around what people would like to hear about with the upcoming aged care changes as well, which people gave some really good thoughts on. And then if you look at the resource library, like for instance, these infographics are particular to the DREAM modules. But this may lose me if I open a different page. No, there we go. Hopefully we can see that. So these infographics, for instance, are really the condensed version of a DREAM module from the education suite that help people to have some key takeaways from that particular module. And people, workplaces are telling us they actually like to have these like up and around, as visual reminders and cues about some of the processes. And these characters also cross-link to the educational suite as well. So the characters that you're seeing here have come from the video modules as well for education. So it's all sort of interlinked. One of the things that we are looking at to try and make the community of practice as engaging as possible is to also just introduce a little bit of characterization, so to have some characters that are, say, going through a respite journey and helping people like engage in a more meaningful way through the lens of a consumer or through the lens of a particular respite professional to access content rather than just having it as sort of flat content. So there's lots of different things that we're looking into for a bit of an innovative way of doing this kind of thing. Yeah, so it just gives you a little bit of an idea.
Say, as someone that I've been an RN for a long time and worked in a variety of different community stuff, if someone said to me, read something called Community of Practice, I would probably put that at the very bottom of my list. If somebody read something, said to me, read tips to help respite be better, I think you'd get a much better response than that. Like, I think your wording in this kind of workforce, if you like, community of practice, what does that even mean to most people?
Yes, completely agree.
So you kind of, you're doing yourself a disservice by that, because this information is fantastic. And a lot of people working in respite and in residential care and all that sort of stuff would love a lot of this information.
Yes.
But don't understand that going to a page called Community of Practice is going to find that.
Term's meaningless. Exactly. Yeah. And we've definitely realised that. I think initially we just did it because we're like, well, it's a community of practice. Let's call it a community of practice. But what we've realised now is that's not landing with the workforce. People don't know what it is. And even if they do, it's overwhelming, right? Like, why should I be part of this whole big community of practice? It sounds daunting. So what we're looking at the moment, when I touched earlier on looking at rebranding a little bit, what we're thinking, and I'd totally be open to ideas. We're not, we are also sort of reaching out to some workforce contacts to see what they think might be a better rebrand, but thinking about something like a dementia respite network or something that sort of gives an idea that it's dementia and respite and a group of some sort without it necessarily being a community of practice. And I think that will sort of soften it and just make it more approachable, hopefully.
And especially like for your people that are, in-home respite workers, they're driving from 1 hour to the next. They don't have time to do, so, like a podcast or something, I think is a great idea to probably get access to those people.
Yes.
But I really, I think you probably need to look at the terminology a bit, because you're losing a lot of people just in that knowing from my, that's just my opinion.
No, you're exactly right. Yeah. And we've literally been having those discussions the last couple of weeks, because we sort of thought we'll see how it goes for 6 months. And we've had the people that are engaging really well, and have had great things to say and have been wonderful, have shaped everything beautifully. But I think we'd like to get a little bit more reach and engagement and keep building that. And I think we've hit that wall where we're just, with that naming, we're just not getting the traction that we'd like.
Especially with all the changes to the aged care sector and all the standards and all that. Then another email that says community of practice. This is good.
It just goes in the too hard basket, doesn't it, with that name?
Absolutely.
No, completely agree.
It makes it really formal, and like Penelope, I'm thinking, well, what is it? Is this writing about like policies and procedures? It just makes it like, it's not very user friendly for the average person.
Yeah, that's very true. Yes, we need a rebrand. Watch this space. It will happen. I've been pushing for it. No, thank you for that feedback. It's really nice to hear it from you guys as well, because we've sort of been feeling that, and now to hear it, as a first impression is really helpful. Thank you. Wonderful. Are there any other questions or anything that people would like to know? Just close that now for the minute. No, sorry, I've got a bit of background noise here in my little foyer. Okay, well, thank you so much for attending, and thank you for all of your feedback and your comments. It's been lovely to reach out to you. If you do want to keep in touch with the project, yeah, feel free to have a look at the Dream website, and you're welcome to sign up and keep an eye on things. Or if you do want to reach out, if you send an email to that dream@utas.edu.au, that will come to the team, and we can start a conversation from there as well.
That's great. Appreciate your time. And
Thank
we did
you.
record it, so we'll
Wonderful. Thanks.
share that around, through the network. So that
Great.
was, very educational. Thank you.
No
Thank
problem.
you.
Thanks everybody.
Thanks
Enjoy your
very
day.
much.
Thank
Thanks.
you.
Sandra.
Bye.